Here we are back again. All right. So, Mo, thank you for your question. Could you repeat one more time so we go straight into the topic?
Yeah, there is a difference between coaching and therapy. So and there is a thin line between both. How we can avoid not to fall in this trap.
So, like some standard answer in the past for coaching and therapy, the difference between two that you would usually find, and it's a very brief answer and, in my opinion, very limited, especially as coaching is developing more and more. And the answer is that the therapy would, how do we know what topic, for example, is the therapy topic and what topic is related to coaching? And then it would say topics related to past are therapy and topics related to future are coaching. But what is the limit within that is that we can't, if the client mentions anything related to their past experience, especially if they have experienced either trauma or some difficulties, we cannot just say, oh, sorry, this is not a coaching topic. I mean, we used to say that in the past. We were advised to even say something like that. So as coaching is evolving, this gray area between two professions is really becoming more and more of a topic. And more therapists, psychologists, and psychotherapists and professionals from the mental health field are getting trained in coaching. So this is also a curious topic. One is, how does the therapist know when they are coaching and when they are doing therapy? And then how coaches can distinguish where their role of a coach stops because there is more of a therapy topic coming in. So let me answer the first one, which is there is a capacity within a professional to provide both therapy and coaching, right? So how do they know where is the line? And the line is, if we have started our engagement with the client as a therapist, we cannot coach them, right? So that is the boundary, basically. On the other side, if I as a therapist have started a coaching engagement with a client, I cannot provide them therapy, even though I am skilled to do so. So the therapist will be ethically invited to go and say, look, we are getting into this topic. It seems to me that it's more of a therapy topic. Maybe we need to look into rearranging our contract and changing our professional dynamic or agreement. And then with the agreement of the client, the therapist will have a different approach. The approach varies and is different. There are so many different therapy ways and so many different coaching ways. So I hope you understand the complexity of my answer, and it might even take the whole session, right? So let me now look into the coaching engagement. So if we are coaching a client, and how do we know when the need for therapy is coming in? One is that the client is bringing the same topic over and over again. There is something that it feels that they are stuck in the past. And within a certain amount of time, let's say within 1 month or a couple of months, the topic is still present and it's still bringing some escalation, and the client is not able to move on. Because coaching in that situation is going to ask for, let's move on, let's adjust the behavior, let's put action into our conversation. have you done this? Have you achieved? What is happening? And the client might be struggling and saying like, I'm, not able to do that. But if they are saying that they are really not resourceful in applying what they are coming up to in terms of shifting the consciousness in their coaching session, then we are obliged to say, it sounds to me that this might be more of a topic for therapy. Would you be open to be connected? Another ethical part for a coach is also to have resources so that we don't necessarily leave the client hanging. So resources would mean, look, there is this therapist that I know will work with mindfulness or has compassionate approach, and we can refer them to them. Or clients sometimes say, I already have a therapist, I will work with them. So we can check that at the beginning of our engagement as well. So when we are, in coaching, we suppose that our clients are creative, resourceful, and whole, which means that they have the capacity. It's just they haven't seen the situation from the angle, for example, that would be based from like with the coaching mindset. And then through the inquiry, we support them in shifting that mindset and finding creative ways to adjust their behavior and get different results. So if we come very close to trauma and difficult therapy-related situation, this coaching inquiry is going to create more hurt for the client, because we are going to ask them to act while they are not resourceful, they are not creative, and they don't feel whole. So that is the key difference between coaching and therapy, is that clients who look for therapy have a sense of brokenness. They feel fatigue. They have really tried. The behavior is ongoing, and they're feeling stuck, and they're beginning to create certain beliefs. I'm not enough. I'm not worthy. Or I'm not capable, and so on. In coaching session, we might come to these kind of limiting beliefs as well. But the client, just through the coaching inquiry, might have the capacity to actually shift this. And we can say, it's like, well, I'm hearing some limiting beliefs. Would you be open to look into that? And they say yes. And then what would be on the other side of the coin? So we can do that through our mindset, right? Like intellectually, we can explore this. And then with mindfulness-based coaching and coaching that we do at BMC Academy, there is also a somatic part, so we can engage the body in that awareness as well. So it just depends on the approach of coaching. All right.
Thank you so much.